I'm Dave Beach. I'm one of the medical social workers at Allen Moore Hospital.
And I'm Shelley Calvin, also a medical social worker at Allen Moore Hospital.
I just have a couple questions for you. What are the negative implications when someone comes into the ER without any insurance?
I think there are two things. Number one, when people don't have insurance, they aren't able to access follow-up care. If they come in with suicidal ideation, for example, trying to hook them up with a counselor or emergency services, but very difficult to access without insurance. The other thing is we see a lot of people in the emergency room who come there for primary care or minor illnesses because they can't afford to go to a doctor or urgent care. So people with a common cold or things like that come into the emergency room because emergency rooms have to treat folks with no insurance, and then it's the only way they can access care, and it jams up the emergency rooms and makes it difficult for people with acute or even life-threatening things to access the service they need.
How does the uninsured population affect the costs for the insured, to the best of your knowledge?
It increases the cost. Both of the premiums people pay for insurance as well as their claims and deductibles are higher because insurance companies, have to balance out. Well, that's not true. The insurance company doesn't have to. They have to pay more for hospital services, for example, because we also have to include the cost of people who can't pay for the service. Therefore, the amounts that are charged to insurance companies are higher.
Yeah, well, we're not directly involved in establishing how much of a compensation there has to be to accommodate the uninsured, providing care to the uninsured. It's clear that it does increase the cost to everyone, particularly if you start looking at a lot of the services that are being provided are more intensive levels of services, like emergency services. That's a higher rate.
Already. It's just not coming directly out of their pockets, so they don't see it. But everybody is going to pay for other people's health care one way or another. Hospital.
Feel about the health care plan that is being proposed right now?
I'm all for it, including the public option. I think people are upset. They don't think that the public option is an option. They're afraid it's going to impinge on them. But I think people's main concern is how it's going to be paid for. People are in survival mode. They want to take care of themselves and their own family, and they're worried about, you know, having to pay extra taxes or extra for their premiums for insurances or things like that. And from what I've heard around here, and that includes from medical staff who know the importance of, you know, people having health coverage, to patients and their families and stuff, everybody's worried about what it will cost them. But I think it's, we have seen people literally die because they don't have health insurance, so they don't get the follow-up care or the medications they need. I think it's essential. And I think people are confused too about whether, you know, the health plan we're talking about now versus social medicine, they're not the same thing, but people think it is, and they're confused about that. And I think that the idea that it might be like socialist medicine is scary to people.
Well, then as a social worker, I would have to say that we deal routinely with people that are dropping through the cracks. The present system is not working adequately.